The effects of the COVID-19 pandemic are felt in all spheres of life, including mental health. Mental health or psychological well-being is an integral part of an individual's capacity to lead a fulfilling life. Disturbances to a person's mental well-being can adversely compromise this capacity and the choices made, leading to diminished functioning at the individual and social levels. Mental health is already a neglected sector of the health system in Malawi. With this background, researchers from the University of Malawi, Unima, and Kamuzu College of Health Sciences, Kuhes, are implementing a COVID-19 and mental health project in 4 districts in Malawi, namely Blantyre, Mangochi, Lilongwe, and Karonga. The project aims at assessing the effects of coronavirus disease, COVID-19 responses on some vulnerable populations' mental health and shed light on the importance of mental health consideration.
This is a big project. We started it last year and it's funded by the National Research Foundation from South Africa. And the investigators are from University of Malawi and Kamuzu University of Health Sciences. And this project is about COVID-19 and mental health.
This project started so that we could find out the effects of COVID-19 on the youth. So first of all, we wanted to know how the COVID-19 affected the adolescents. We wanted to know to what extent COVID-19 affected the mental health workers. We wanted to know the perceptions and the beliefs that people in communities have concerning mental health, and also just to be able to raise the awareness of COVID-19 and how it affected people in terms of their mental health.
One of the activities for the project was a mental health talk show that took place on the 19th of March 2022 at Kamuzu University of Health Sciences, Kuhes, in Lilongwe campus. The speakers in the talk show covered the following topics: introduction to mental health, mental disorders, risk factors of mental disorders, ways of coping with mental health problems, and service providers for mental health services. The aim of holding this mental health talk show was to raise mental health awareness and increased engagement with the general public on their mental health. The talk show incorporated a question and answer session where participants were allowed to ask questions related to COVID-19 and mental health.
We had a mental health talk show that took place at Kuhes Lilongwe campus, which saw a number of people coming together on the 19th of March. So this was a program that was organized with the intentions of bringing in different speakers who elaborated and explained more of what mental health is about, the causes and the symptoms, and also we were able to explain where people can get treatment if they realize that they have symptoms of mental health.
The project also implemented an awareness campaign on the importance of mental health and consideration of mental health in public policy and health strategy in Mangochi district. The campaign was meant to raise awareness of issues surrounding mental health and advocate that communities should be able to support people with mental health issues.
Today we're just doing mental health promotion, so community engagement. We wanted to engage the community to find out whether they know what mental health problems are and what causes mental health problems, some of the things that they can do to help people that are, that have mental health problems, and where they can refer people with mental health problems in our community, what happens. We also wanted to tackle misconceptions about mental disorders. So we've done that through Theatre for Development, trying to engage the community to see how the community discriminates sometimes against people who who have mental health issues, and we engage them on how then do they help, with all these misconceptions. How do we squash these misconceptions together with the community?
Zona hadi zimene zakambidwa lerozi zokhuza ni maula angwiro kuno kumangochi zuchitikadi pali anthu ambiri amene manyumba amwe angokhala mwina chifukwa ndi maganizo ena akeso zimene zinachikira mmoyo mwawo, koma anthu amene akusalidwa ndi muzinthu zambiri. Ndiye uthenga amene wabwerawo uthandiza ifeyo ngati mafumu, tauza mafumu ang'onoang'ono magulupu kuti pali anthu ambiri amene muzi mwangokhala amene ali ndi vuto limeneli, ndiye tisawapondereze.
As part of the event, Theatre for Development performances were done to help people appreciate mental health issues and explore ways how they can identify affected individuals and help them.
The first two performances focused on exploring these types of stigma that people experience, people with the mental health conditions, but also the misconceptions that are there about mental health in the community, and also the causes of stigma, and misconceptions, its effects as well. And some of the issues that came out were that people with mental health issues mostly are not considered or are segregated, in developmental activities. And after these first two performances, a mental health expert came in to now comment on those issues, but also address them, and also responded to the questions that people had regarding mental health issues in the community. And the last performance now showed the community what could be the ideal situation if all the stigma and misconceptions about mental health ends in the community.
By the end of this project, there will be enhanced research on mental health in Malawi, increased engagement with stakeholders like health practitioners, policymakers, lawmakers, academia, and government officials on mental health, and increased engagement with the general public on their mental health.